And what we really need to look at is, why is the body creating high blood pressure? Why is the body creating high cholesterol, which is not a problem, by the way? Why? The whys. So I use that a lot in my practice. I want to look for the why, not the what. The what is caused by the why. It's important to truly search out the foundational issues that are broken. I call them broken pathways. It might be estrogen detox. It might be liver function, all sorts of things that are happening that are missed. And once again, we're throwing meds or supplements on top and not using supplements or nature to.
Welcome to the Deconstructing Conventional podcast. This interview is brought to you by Healing United, a private membership association committed to helping you reclaim sovereignty over your health, life, and future. You could say our tagline is question everything and rebuild intentionally. In the audio format of the show, there's additional commentary before each episode, and there are also over a dozen audio-only episodes. You can find the show anywhere you listen to podcasts, including the Healing United PMA app. Look for it in the App Store, and if you want to learn more about the work we do, and especially how we help people heal when the doctors have no answers, visit us online at healingunited.today. Now, on with the show. All right, hello everyone. Welcome to my conversation with the lovely Dr. Kelley Reis. So a few things about her. She is a board-certified naturopathic physician, a functional wellness expert, and a Kentucky native. She graduated from the National University of Natural Medicine in Portland, Oregon, and has been in practice since 2004. Her passion is helping clients do what she calls fact find, to uncover root health issues and imbalances within the foundational systems of the body that she calls gut health, hormone balance, detoxification, and inflammatory responses. She works to resolve the underlying inflammation and stress that causes the breakdown of health. Go imagine that. Like, what a concept. So you all can probably tell why I like her already, but it gets better. So Dr. Kelley's functional approach focuses on the whole person. While she does utilize nutritional supplementation in her practice, she does not just manage patient symptoms with supplements. And like me, she believes you cannot supplement a person back to health. You need an individualized, comprehensive approach to treat the whole person. So I love that. So she also has this quote on her website. I just wanted to read you to give you a sense of how she thinks. So it says, "I believe that all physical disease has an emotional, mental, and spiritual component. Therefore, healing must take place on all those levels. It involves a strong commitment on the part of my client because all healing occurs from within, utilizing a comprehensive approach based in functional medicine, full diagnostic testing, lifestyle planning, and common sense. I partner with my clients to educate and support them on how they can truly improve their health and life on all levels." So fantastic. You and I are cut from the same cloth, Dr. Kelley. So welcome to the show. Thanks for taking the time today.
Thank you so much, Christian. I really appreciate the invitation.
You're welcome. All right. So I remember when my wife first sent me your website, she said you were interested in joining our homeschool co-op. And I was like, oh, cool. So I checked out your website. I found out that you're a naturopath who does thermography. You have a private membership association. And then I checked out your social media and I thought, oh, this woman's bold. She's not afraid to call out the medical industrial complex or the trampling of our freedoms, right? And I just knew I needed to interview you. So awesome. Before we get to some of that, rewind your story a bit and give us some context of who you are. Did you always know you wanted to be a doctor? And of all the different disciplines you could have gotten into, what made you settle on becoming a naturopath?
Epiphany, to say the least. So I was in 1996 to 99, I was at the University of Florida getting a master's in zoology with an emphasis in paleontology.
Huh.
So yeah, in my spare time for fun, I would look up herb books and people would ask me, how do I handle menstrual cramps? How do I do this? Because it was just my fun pastime.
Huh.
So fast forward a little bit, finishing up, I was a little disenchanted by academia, to say the least, and was, still looking at getting a PhD in Austin, Texas, in geology, and went there to interview, woke up in the middle of the night and went, what am I doing? Like, this is not the direction I want to go. And thought I would be, an herbalist or something that, sounded really just grounding. And found out I could be an actual naturopathic physician. I didn't even know what a naturopathic physician was at that point. And I'm an overachiever. So I was like, why be an herbalist if I can be a naturopathic physician and be the doctor part two? So came home back to Florida and found out about NUNM in Portland, flew probably a month later, flew out there to check it out. And the rest is history. I was like, wow, I can be a doctor and do all of this too. So went out there. I was in naturopathic medical school from 1999 to 2004. So 5 years of naturopathic medical school. And, we're very highly trained. So, it's 4 to 6 years, depending on the track you take. So
wow,
that's my story, how I became a naturopath.
nice. Well, we'll get into the principles of naturopathy and what attracted you to it in a second. But the other part of your story that I thought was fascinating is similar to me and my family. You and yours are COVID transplants. So you went to school in Portland, you went to North Carolina, had a practice there, and then you ended up in Florida. So really, give us your COVID story and what kind of moved you around, what was going on in your mind?
Well, thank goodness I moved out of Portland, Oregon in 2017. Like, I don't even know if we could have survived Portland through the COVID scam.
Right.
So we were in Raleigh. I figured, well, I'm from Kentucky. So, let's get closer to where I grew up. My husband is from Eastern Europe, so that wasn't an option. So it was, let's get a little bit closer to the Southeast US. I can travel and see my family more. And so we picked Raleigh, thinking it was, a little more conservative, more Southern. And we spent from 2017 to 2022 in Raleigh. And it opened our eyes to how, not conservative and how Portland-like Raleigh, North Carolina is. So, going through the COVID era, I call it, the COVID era in Raleigh was very eye-opening. I was blown away by the just sheep, the followers, people not stepping up for the most part. They're a handful, but yeah. So then we thought, boy, we really need to start to homestead. We really need to take this into our own hands and be able to grow food, raise food, and live as rural in a conservative area as we can. So city people, now we're rural Florida.
Yeah.
We love it. We love every bit of it. So we feel much more with our people here.
Yeah, I bet. No, similar sentiments for us. It's just like, wait, this is not how I thought things were going to go in terms of freedom and that being able to, tyranny being able to be put in check. And so I was like, we got to find a place where we can flourish. And Virginia was not it. So I can relate to you. Yeah. Okay.
We actually looked at Virginia for a second and went, what are we doing?
Yeah.
Like, this isn't the direction we want to go.
Yeah. All right. Well, so there's so many things we could talk about, but from someone who isn't afraid to speak truth, I wanted to zoom in on two things before we get to one of your specialties, which is thermography. So the first one is just to ask you, why did you set up your practice as a private membership association? So tell us the story behind that and what makes a PMA special in your mind.
Yeah. So I've been harassed. I've been in practice almost 21 years. And, when I practiced in Oregon, we're very equal to MDs. We're equal to MDs in about 20 states, but we're very regulated in Oregon. And so moving to Raleigh, we are not licensed. And what I mean by that is we can't practice to the full scope of our training. We can't prescribe, we can't diagnose. So once I got to Raleigh, I had, over those 5 years, I had two interesting experiences. The first was the FDA calling me about my thermography business, threatening to shut me down based on what wasn't written, a disclaimer wasn't written on my website. So that was the first thing, that if I don't put that on there, they will make sure I'm shut down. The second was the North Carolina Board of Nutrition decided to come after me. And claim, I don't care if you're a naturopathic physician and have extremely, comprehensive training well beyond a nutritionist. We want to harass you as much as we can. And it was a legal battle for probably 9 months, which I did win. However, that made me say, you know what? I need to protect myself and my clients from any type of, I'm going to call it governmental intervention, and need to make sure that I am able to do what I do best. I don't do anything illegal. I do everything by the book in the state that I practice in. However, I need to make sure we are protected. And a PMA, I am legally a health church, and that is because I do believe so strongly in the spiritual aspect of health. I'm not going to be someone's preacher, pastor, rabbi, anything like that. However, it's such a crucial component to healing. It fits so well with being a PMA. So it is a non-negotiable. I do not take any client outside of my PMA now. And it is a constitutionally protected entity. So it should be, air quotes, should be protected from government overreach. But
yeah, no, that's great. We set up Healing United as a PMA for that same reason. We just need a protected space to speak freely and do what we can do to help people. And so that, similar journey you had there. That's fantastic.
Absolutely.
Well, and for those of you who didn't know what a PMA is, now you know. So, okay. The second thing I want to go over before we get to thermography is just really the 6 principles of naturopathy, because I think it's so timely. The more the mask slips off the medical system lately, the more the core principles of naturopathy just stand in sharp contrast to the principles of Western allopathic or so-called conventional medicine. So to me, they're just a great introduction to how doctors like you think. And really, I think a reminder of what doctors should be in the first place. So we'll just kind of briefly go over those 6. But the first one is that the medical system would claim they follow this one, but it's first, do no harm. So tell me how a naturopath frames that, or where it may not be so such a truism in the medical world.
I mean, 2 words, big pharma. So first, do no harm. The goal is to remove obstacles, not add obstacles. And I think that's missed in, conventional medicine every day, all day long. It's even missed in naturopathic medicine. Not all naturopaths truly follow first, do no harm. But it really is removing obstacles and making sure that we are allowing the body to move forward in health without getting in the way.
Yeah. Yep. So what are a couple examples of harm that are just kind of defaulted to? You mentioned big pharma. Is anything else that stands out to you?
I mean, I think people are over supplemented. I think that is harm. I think, while I appreciate the functional medicine movement, I believe it's also adding some harm. This may not be a favorite, for me to say, but I think for some, it's become a racket to figure out how to have supplement sales, and there's a lot of harm.
Yeah.
I think that's a big one. I think it's overlooked a lot. You shouldn't need thousands of dollars of supplements to be healthy.
Right. Exactly. We proudly claim we are supplement minimalists and try to give people a few things they actually need. And there's just so much waste that you get a suitcase full of supplements with so many of these naturopathic or other big coaching programs. And it just baffles me it's like, eat this way and take a whole boatload of supplements as if that's the cure. And there's so much more to it. So
much more to it.
Cool. Okay. Yeah. Principle number 2 is the healing power of nature. So talk to us about that one. What does that mean to you?
So, I would base this more kind of herbs, healing herbs, food as medicine is probably my favorite. It is designed, divinely designed to help us be healthy. And it's truly, in my eyes, all the healing we need is through nature. And it's just sitting out there for us. There's like an herb that can make us sick or the counterpart, the healing or the antidote is right next to it in nature. It's pretty cool, when you think about how it's all designed.
Yeah. Well, and it stands to me, it's in sharp contrast to the way that medicine thinks. There's a hubris that one, they just kind of neglect the idea that the body's the one doing the healing. But two, it's the healing is from there's nature's bounty rather than some sort of chemical cocktail or pharmakia, which literally means witchcraft or sorcery, which is where we get the word pharmaceutical. There's the idea that we, as the wiser people, can dictate and tell the body what to do rather than recognize that it knows how to do in our job. To your point, just get out of its way. So,
right.
Yeah. Okay.
100%.
Yep. Okay. Number 3 is identify and treat the causes, which if you know anything about the medical system, they don't do this. But talk to us about what that one means to you.
So, the cause, I see this all the time in conventional and holistic medicine, is we're treating blood pressure, we're treating high cholesterol. And what we really need to look at is, why is the body creating high blood pressure? Why is the body creating high cholesterol, which is not a problem, by the way.
Right.
But why? The why. So I use that a lot in my practice. I want to look for the why, not the what.
Yeah.
The what is caused by the why.
Right.
And it's important to truly search out the foundational issues that are broken. I call them broken pathways. It might be estrogen detox. It might be poor liver function. It might be, all sorts of things that are happening that are missed. And once again, we're throwing meds or supplements on top and not using supplements or nature to address those broken pathways in the deepest foundations.
Right. Well, and if you ask a medical doctor, if it sounds funny to you, the idea that medical doctors don't identify and treat causes, just go ask them the simple question, why is my body experiencing this, or where is this coming from? And you're going to get probably one of 5 answers. It's genetics, it's stress, it's aging, or I don't know, or it's all in your head. And you should talk to a shrink. Like, that's the closest they get to identifying any sort of cause.
And they throw stress around like it's not a big deal. Oh, it's just stress. I hear that phrase all the time. Stress, high cortisol will take you out. It'll damage your DNA. It'll cause all sorts of disease. Yet it's thrown around like, oh, it's in your head, or, oh, you have too much weight on, you need to diet and lose weight. And there's so many excuses given. I tell my clients, if you have a crack in your wall and you keep, smearing spackle on your wall on the crack, and it's due to the foundation being off, you're always going to have a vulnerable area where that crack keeps showing itself until you fix the foundation. So if you don't fix the foundation and really get to that cause, you are just chasing your tail, non-ending.
Right. Yeah. So I love that one as a contrast. Okay. Principle number 4 is doctor as teacher, which I think is brilliant. So explain what that means to you.
If I had a favorite out of all 6 of these, it's this one, docere, doctor as teacher. Where this has gotten, sent down a pathway of the doctor is the pill pusher, the doctor is the supplement giver, we are teachers. First and foremost, we are teachers. And I tell every client that I accept, because unfortunately I can't take on every client who wants to see me. But every client I take on, I ask, are you willing to learn? Because my job is to educate you. You should not need me. If you need me long-term, I haven't done my job.
Right.
You shouldn't need any doctor. We should really be back to this old school where we relearn how to eat. We relearn how to be healthy, truly healthy. And that's why all the levels, spiritual, mental, emotional, physical, come in. But my job is to train you not to need me.
Right. Love that. Yeah. And we describe ourselves as teachers as well. We are not even healers. Like, the body's the one that does that. We just teach you how to get out of its way and empower it. And to me, this stands in contrast to the almost doctor as God kind of persona that the medical system, we are infallible and we are primary, and we have consensus.
Well, the beauty of the COVID scam is I think, boy, did that shine a light. The light
Right.
flipped on and the roaches are scattering, and we got to see a lot of them.
Yeah, the proclamations from on high, just that doesn't
Yes.
seem to work anymore. And
Yes.
we need people who can teach us. I love that that's wrapped into how you think. So, okay,
Yes.
principle number 5 is treat the whole person. That may be my favorite one, but tell us what that means to you. You've already hinted at it a little bit, but expand it.
Well, think about conventional medicine. We have our gastroenterologist, our OB-GYN, we have our cardiologist. They can't see past their system that they are trained in.
Right.
And those systems interact on a daily basis. We're not just a gut,
Or
we're
an
not
ear.
just a brain or a throat.
Right.
Or, those are all connected. And how it got to the point of specialties baffles me,
Right.
because it's not the way the body works. We
Right.
have to treat the whole body. I'm a big believer, hormones, gut detoxification, inflammation, like those are very foundational in, as far
Right.
as the whole body is concerned.
Mm-hmm.
But, you have to look at how the brain connects to the gut, how, your joint pains, connect to your diet, and how, every aspect has to truly be, looked at to get a better understanding of how to help someone correct it.
Yeah, well, and it's not the world that the medical system likes to stay in. They've created this, and I had to finally break that spell, the specialty idea. Like, I'm a specialist, as if there is a special, simple answer for a complex problem. And if I made up the word partialist to describe it, and if it's like,
Mm-hmm, mm-hmm.
okay, now we can have an honest conversation because you're looking at a part of the body and a zoomed in part of a system. But unless you can zoom out, you're ignoring this fifth principle of treat the whole person, and you're playing whack-a-mole at that point. So
Absolutely.
love that one. Okay, number 6 is prevention, which you would think be a thing doctors would be into, but even the alternative or the restorative world is still not great at this prevention thing. It's typically mostly reactionary. So where does doctor as teacher and prevention come into your practice?
Well, I can't talk about it with talking about the medical mafia, to be honest. That prevention creates healthy people. Healthy people don't pay the medical mafia's bill. And what I mean by that is conventional medicine, big pharma, big ag, insurance companies, they're one big conglomerate. And if disease is prevented, their money goes away.
Mm.
And so prevention is everything. Like, if I can help my clients, rarely do I get the client, I get them, but rarely do I get the client who's like, I just want to prevent disease. I love it when I get that client. I'm like,
Yeah.
oh my gosh, you are such the unicorn.
Right.
But I get the people who may be in the first stages or in the late stages.
Mm-hmm.
But prevention, if we can prevent, when I get those teenagers or, early 20-year-olds, which I do a lot, actually, that I can really help them move forward in their health by preventing all of this chronic disease down the road. Unfortunately, a number of them come to me with already chronic diseases that young.
Yeah.
But prevention is key. But boy, I mean, even, insurance companies fight against it all the time because they don't want to pay for any type of preventative care.
Yeah, well, it's funny. There's got to be a way for any of you thinkers out there who like to deconstruct conventional things. There's got to be a way to show the insurance companies the math, the money they save and don't have to pay in treatment, if we could just find and fund some simple preventative things. So any of you thinkers out there, do it. But yeah, I love that and I'm right there with you as a coach. It's rare to find somebody's like, I'm okay, but I want to make sure I stay this way and learn what I don't know about health, because there's health classes in high school and college are a joke. They don't teach you anything about
yeah, absolutely
what you should actually be doing.
And they are in medical schools too, honestly.
Yeah, well, you guys don't even study nutrition in medical school. It just baffles me. Like the engine, like the gas that runs the engine, you have no clue how that works at all.
Yeah, nope.
Yeah. So, okay. Well, so those are the 6 principles of naturopathy. I'll read them again just for the listener. So we've got: first, do no harm; the healing power of nature; identify and treat the cause; doctor as healer; treat the whole human or whole person, and prevention. So those are the 6 principles. So the other thing I wanted to ask you about is just like, we're getting into thermography here, but just like chiropractors or functional medicine doctors or a lot of other doctors, there are so many adjunct modalities or specialties that you could have picked to add to your practice, but you picked thermography. So first, tell us what thermography is. Let's define it. And then tell us why you picked it as a tool in your toolkit.
Sure. So thermography is truly, the study of heat as it's emitted from the body. And
Okay.
it's incredibly subtle. So I don't want you to think like, you can feel it. It's not, it's so much more subtle than that. So, I mean, they were, I think it was like 400 BC, 500 BC, somewhere around there. They were putting mud on people's bodies and watching where it dried and say, that's where you have issues. That's where you're diseased, probably the word, so thermal, temperatures have been used forever, truly forever. And it's been obviously refined and fine-tuned over the many years, but it is a concept that has been around for very long. And so there's a thermal, very subtle energy that's emitted by the human body. And thermography nowadays is a camera, like I use the Meditherm equipment, and I can explain that in greater detail. It's a camera that only is sensing, it can pick up just the first 5 millimeters of skin temperature. So it is reading the temperature on the first 5 millimeters depth of skin.
Okay.
And it is incredibly sensitive to the 100th of a degree.
Wow.
And so thermography, you take an image and it's pixelated, of course, as any image. And each image has up to 307,000 pixels, each with its own temperature measurement.
Wow.
Up to 1/100th of a degree. So that's how sensitive thermography is. And so the human body, it's kind of known that it will emit more warmth in areas of inflammation or disease, but it will also be cooler with other types of disease, like neurological, for example. So it's not always, a lot of people think you're taking a picture and looking for hot spots, like the white with the red around it. That's not exactly the case. It's more of it's a finer, more detailed science than looking for hot spots. But that's the basis, that it's reading the temperature that's emitted, infrared heat. So it's also known as digital infrared, thermal imaging, DITI, or thermography. So.
Wow. Fantastically effective, or just, I didn't know it could read at that small of a level, and until now I hadn't put it together that nerve damage or neurological issues makes it colder, but it makes sense to me because that's where the blood flow goes through, and that's what brings the energy and the life force to the body. And if it's not happening, that area would cool down. That's fascinating.
Yeah. And you did ask me being in practice, like I said, now 21 years, I've done thermography for 14 of those. I found myself needing a tool to give me more information about a client. And thermography, the more I researched, the more valuable it became to me, that something that I can have in my office, that I could image someone and get detailed information about where to look. So, I have leg pain. Well, is it vascular? Is it bone? Is it joint? Is it muscle? Is it nerve? I mean, there's so many layers in the human body.
Right.
Oh, wow, that looks nerve. Okay, let's get this kind of imaging on top of that to see if we can, nail down what we're dealing with.
When it fits the frame of identify, well, you're looking for causes.
Causes.
You're not trying to just treat a symptom. And if interesting, as you're talking, I'm thinking back to my time as a personal trainer where it became apparent to me early on that where someone has pain isn't necessarily where the problem is. Like you could have
Exactly.
knee pain because your foot or your hip are off or your abs can't fire or any number of symptoms. And you can have shoulder pain because your abs can't release or they're not strong enough to stabilize your arm when you move it. And it really made me think much more holistically in the biomechanical world initially. And then it's like, wait a minute, it's all these systems. They all have to be able to work together. And it's just fun to interact with somebody who thinks that way. And I can see why thermography kind of jumped out as if I understand it correctly, there's an earlier ability to find or see things often than other tools that peek into the body. Is that correct?
Absolutely. So it's a physiological screening tool more than it's not an anatomical screening tool.
Okay.
So we're not looking, once again, it kind of goes with my philosophy. We're not looking for the what, we're looking for the why.
Right. Yeah.
So although sometimes we do find the what with thermography, like a stress fracture or, a dental abscess, things like that. But it's looking for processes that are happening. So that's why it's physiological. So it's a process versus, we'll talk about breast thermography and mammograms, but it's not looking for the tumor. It's looking for the angiogenesis, the formation of blood vessels that will feed an area that may later become a tumor. So that's why it's a physiological test. And it really provides so much insight. You had mentioned that, sometimes, the knee may hurt. Well, the left knee may hurt, but on thermography, we find it's a right, sacroiliac issue and you're overcompensating on the left.
Exactly.
And here, your left knee pain, we need to address your right SI joint.
Yeah. It's so much more fun to be able to go upstream and investigate what would be contributing to this. Why is the knee being punished right now?
It fits in my fault. It's not even the knee's fault. And here we're wrapping the knee, icing the knee, and we need to be focusing on the right SI joint.
Right, exactly.
And we didn't even know until we were able to use this non-invasive tool that provided direction. So I did it solely for providing direction, for helping me help my clients.
Yeah. Okay. One other nuance I want to make sure I get on the record is the difference between you describe it as an assessment, not a diagnostic. So what's the difference there?
So there are, I would say, few diagnostic tools, and I'm going to use the breast for an example.
Okay.
So screen says, area of concern. So thermography, area of concern. Mammogram, area of concern. Then the next step is an MRI or an ultrasound. Ultrasound's a much better choice. Ultrasound, yes, there is an area of concern. The biopsy pulls cells out. They look at the pathology. That's a diagnostic tool, the biopsy.
Yeah.
So the screening tools are, once again, providing location, suspicion, so we can't diagnose from something that's just looking for the suspicion. We can isolate it, identify it, to then look at it more from a pathological standpoint.
Yeah. Well, and that documentary you sent me that we'll mention in a second, that mentioned biopsies and the risk. I'd never put it together, but the idea of you puncture the skin, you scrape it, and then you pull something out, and you're basically creating this vacuum, this suction where that was. And if you've hit a tumor and you pull that fluid out of that, you could be spreading it more than you're actually getting the insight you need. There's risk here. There's whether it's micro trauma or bigger, there's trauma that's going on in the body in that process as well. So just something else to think about when you're thinking about diagnostics and the ways that the medical system wants to probe you.
I mean, biopsies have an absolute risk. There's a lot of data out there showing, and that there are tumors along a line.
Really?
They're microscopic tumors along the line of the biopsy needle.
Yeah. And they just flippantly prescribe them as if that's the next thing we have to do this. And
Kit, I would love just to digress for a moment.
Go for it.
Informed consent. So what was hammered into me in naturopathic medical school was informed consent. It's gone now.
Yeah.
I know that, I know that informed consent is a thing of the past, and it's criminal.
Mm-hmm.
But informed consent is what's required in it is what's called a PAR-Q, PAR-Q.
Mm-hmm.
And P stands for this is true informed consent. Was the procedure explained in detail? And this goes for anything, whether it's a jab to the arm or a mammogram.
Mm-hmm.
Was the procedure explained to you in detail? Were you given alternatives to such procedure? Safe alternatives? Were you explained the risks? Detailed?
Right.
And did you have an opportunity to ask questions? It is a thing of the past. No one discusses. There's no informed consent anymore.
Yeah. I'm trying to think back to any doctor visit I ever had where those 4 things were done. I can't think of one.
Yeah. So women who are getting biopsies, breast biopsies, do they do a PAR-Q? We used to have to document it. The P, the A, yes, I did a PAR-Q.
Wow.
It's not, yeah.
It's just a fairy dusted platitude at this point. There's no.
Absolutely. I just wanted to mention that because it's an issue for me that in this era that is significantly lacking, and people, it's like boiling the frog. People aren't realizing that that's even gone because they didn't realize it was there before. Only we knew it was there before. Yeah.
Well, and it's just that I try to think, like, when did this become the norm? It kind of crept in as this residue from the era when doctors were put on such a pedestal and science was worshipped as it's going to tell us everything. And we're still kind of at the coattails of this doctor as infallible, doctor knows best. My intuition can't keep up, and we should just trust everything. And they've just almost weaponized that against us now. They have the veneer of informed consent, but it's really not there.
Well, and they've created all these annual visits to show you what's wrong so they can put you on a med. Right. I mean, they've created this. This is designed on purpose.
Yeah. No, you're about to get another dose of that in a second. So before we get there, I want to just kind of whet their appetite for how cool thermography is or can be. So without divulging any personal information, give us a story or two about where thermography may have helped you find something that other doctors were missing. And you mentioned one already with dental problems, but give us a couple stories to kind of help people see some of the potential here that may be helpful to them.
Absolutely. So one client came to me with back pain, and it was becoming more and more severe. 55-year-old woman, in good health overall, and worked out, all of this. She went to the ER. Her pain was getting so bad. They barely examined her, and they sent her home and said, you just have low back pain. Here's some pain meds. So yes.
Thanks. I already knew that.
Right. Dismissed. Right. Yeah. That is just muscle pull, no exam, no imaging. The next morning I did I'm going to call it kind of an emergency with a stat. I asked for a stat interpretation.
What does that mean for somebody who doesn't know?
So real quick, I'm a thermographer, like a photographer. So I take the images. I always submit them to board certified thermologists. So think radiologists. They are MDs who are highly trained in interpreting the thermograms, the images. And so they take the medical history, they look at the images, and they interpret. So I asked for a stat like within an hour getting this report back because her pain was building. And they said, you really need to send her back to the ER and have them look for diverticulitis. And lo and behold, she had diverticulitis. And they missed it, sent her home. I mean, she could have had a ruptured colon from diverticulitis. They sent her home because they're like, you're 55, it's back pain.
Yeah.
And they would have missed diverticulitis. So that was a fantastic one. I did mention the dental abscess, but there was a really good case where a client, she had chronic sinus infections, and she tried everything, the nasal sprays, antibiotics, and that were very sinus based. And she was so frustrated. And I said, you know what, let me just do some images of your head and neck. And she happened to be a dental hygienist. So this was kind of perfect, for this. But I said, did you ever have a root canal, like bottom, left molar? And she goes, I do have a root canal there. And I said, they, have them do a little more angled x-ray and a little, see if they can do like a more specific x-ray. And they didn't. Lo and behold, she had a dental abscess. And that dental abscess was actually we treated directly the dental abscess, and it fixed her sinus infection, chronic sinus infections, which wasn't a sinus infection to start with.
Right.
It was her sinuses reacting to the abscess tooth.
Right. Love it. It's just something people don't think to investigate. Okay. Any other stories you want to mention?
Carotid arteries, they show up a lot in people. It's a really good assessment of carotid arteries. I've picked up occlusive disease, like, blockages in carotids. Thermography is a little more sensitive, so we can pick things up at about 20% when like a Doppler ultrasound at a 60%. This person just had unknown occlusive disease that was greater than 60%. I sent her for a Doppler ultrasound. This was in Oregon, where they let me do that. I sent her for a Doppler ultrasound, and she absolutely had like 90% blockage in her carotid. So we were able to address that, and she was forever grateful because, she was headed for a stroke or something for sure down the road.
Right on. Okay. Well, one of the places that thermography really shines is as breast cancer or screening or assessing the breast in some way. So it's, in my mind, it's such a great replacement for mammograms, which we'll get into in a second. But how does thermography shine when it comes to the breasts? And feel free to mention the documentary you told me to watch, The Breast Kept Secret. That one blew my mind. So,
yeah. So, thermography, it's apples and oranges when it comes to mammogram and thermography. They are not the same. As I kind of mentioned before, mammogram is looking for a what? It's looking for a pea size or larger structure. A lot of times they'll look for calcifications, but this is the sad part. Calcifications about 90% of the time are benign. And they will use the word calcifications. It looks suspicious. We need that biopsy. Now we're jabbing a needle into a woman's breast. So they're not equal. It's hard to say replacement for me. And that's not just because the FDA, hates thermography, makes me not say it, but they're really not the same. So thermography is always going to look at the process, sometimes 8 to 10 years before a structure the size of a pea could ever grow. So it's very, it's very preventative. And that's, one of the main things that I like about it is how preventative it is. Like we can get on, it can assess for estrogen dominance. There's patterns that will give us like hormone dominance, estrogen dominance. Runaway estrogen is very dangerous for breast health. And it's very common, especially with even the bioidentical hormone, gurus out there. Everybody's jabbing pellets and rubbing creams on, and it's not without risks as well. But for, a mammogram is just not the same. There's no danger risks with thermography. It is non-invasive, no radiation, doesn't touch a person. So there's no trauma, physical trauma. I tell people the least comfortable part for some people is, we have to see skin. So when I image, you have to be nude and I have to see skin. I keep my clients draped as much as possible, but when I have to image breasts, I have to image breasts. Right. So, but other than that, like a mammogram is horribly archaic.
Tell us why.
Well, so, if you look at what tissues are the most sensitive to radiation. So there are some studies in Japan, nuclear reactors, and, after Chernobyl in Europe. What tissues are most susceptible to like radiation toxicity, radiation damage? Guess what ranks at the top? Breast tissue.
Yeah.
breast
Go
tissue.
figure.
Thyroid. What do we do when we get x-rays for dental? We cover our thyroid. They have thyroid flaps because glandular tissue is so sensitive to radiation. When we get dental x-rays, they cover the thyroid, they protect the thyroid. And here we are smashing. They say just trauma, getting hit in the breast can cause injury that, is very damaging. But now we smash the breasts in different ways with what would be the equivalent of 3 bowling balls on a breast.
Yeah.
3 bowling balls.
I didn't know that part. I knew about the radiation.
Pounds.
Yeah. Well,
44 pounds smashing a breast.
Yeah.
Then let's send a bunch of radiation into that now traumatized tissue. So trauma to the breast is a risk factor for breast cancer. Radiation is definitely, without the trauma, radiation just in general is a risk factor for breast cancer. Now we've just traumatized and sent radiation through a breast. And they say, well, it's low. Well, it's not as low when you isolate it onto a breast. It's very concentrated on a very particular area. And then 3D are magnified. It's even more radiation.
Yeah. Well, and if you guys have not seen the documentary, The Breast Kept Secret, I would encourage you to check it out. It's another one of those that, to me, it started making me angry. It's egregious how harmful and dehumanizing these mammograms have built. And I kind of just, watching it, I started feeling like, gosh, this is almost as bad as statins or mercury fillings or vaccines or even psych meds. It's almost like everything the medical industrial complex touches, they have to find a way to, I felt like I was overstating this, but I feel like they find a way to weaponize and create fear-based or harm-based interventions or medicines. And like everything else, is just enough that might make you well. They don't talk about that, but they talk about this. And so I guess I'm grateful that you're here to keep me from getting too hot under the collar.
Well, it's hard not to, right?
Yeah.
It's archaic. It's, if you really look at the studies, the ones that promote it and say, oh, well, it prevents sometimes. Right. Well, I think it's 1 in 10 might benefit. 1 in 10 might benefit from a mammogram. That means 90% of people don't.
Yeah.
And the longer you're getting, it's the cumulative effect. So just like the thyroid, it's the cumulative effect of the radiation year after year. So what they, just did with the FDA, lowering it now, 40s, and no, you're 35, you have a risk for breast cancer because your mom had it. So we need to start mammograms at 35. Well, you have a lump, you're 25. Let's do yearly mammograms at 25. The cumulative risk of this radiation and trauma. And then they say a diagnostic, this one frustrates me. They will do a screening mammogram. Then they'll send you back if they see something for a diagnostic mammogram. As I said before, there's no such thing. You can't diagnose, but what they're doing is they're trying to look at a specific area. And guess what they do? They push harder. So there's extensively more pressure. And then they're radiating it again. And all they're doing is creating more breast cancer in my eyes. But something I want to say, I am a medical freedom diehard. People should be able to choose what they need or want to do with their body. So if a woman asks me, should I get a mammogram? I'm like, that is a very specific choice for you to make. But here are some things you need to read on both sides. Here are things you need to read to make sure you are educated. Once again, the PAR-Q. Like, you need to know the risks and benefits. Does it benefit you more than there are risks? But I would never say, no, don't do that, because who am I to tell someone, and that became even bigger, in the last 4 years. But I think if you have informed consent and you're educated, you get to make the choice of what you want to do.
Yeah. Well, and a couple of things I want to highlight relative to your comments. There was a study in the Journal of the American Medical Association in 2022, so recently, where they examined women over 10 years and found that there's a 56% chance you're going to get a false positive. So there's
Yes.
it's basically like 5 or 6 times that, we're going to, or 56% of the time, there's a good chance we're going to freak you out over something that totally was nothing and send you into who knows how much emotional trauma to deal with that. And then on the flip side, there was a 38% chance of a false negative.
Yes. So
Like,
what's the point?
what are we even doing? Right. At this point, it's ridiculous.
I mean, aren't we a more advanced culture that there's got to be something better than putting 3 bowling balls on a woman's breast and then throwing radiation in there and saying, this will help you not get cancer that's
Right.
caused by radiation.
Right. Well, and
it's absurd.
Yeah. And it gets worse. So a couple weeks ago, 2, 3 weeks ago, the FDA put out a new requirement that any woman receiving a mammogram has to be told about her breast density as it relates to health. So then I'm reading through the new guidelines, and I'm trying to be fair, but admittedly cynical about anything the FDA touches at this point. And their guidelines just look to me like another reason to give women something to be anxious about. And so for in case you don't know, the recommendation is if you have dense breasts, the idea is that they may not be able to see the cancer. So if that's you, then we suggest you do more testing. You can do the ultrasounds or MRIs, or you can go genetic testing or all the way to biopsy. And it's just, to me, it was like, oh, great. Another example where testing, just like COVID, is now weaponized against us. And in this case, it's just weaponized against women. So
it's scare tactics.
It is.
It's so you fall in line.
Mm-hmm.
And you're the good little sheep falling in line, doing what they say, when the whole time, I believe it's designed to make us sicker and sicker and more reliant until we don't even realize, oh my gosh, back in the day, we used to be healthy and we ate real food and we didn't do all this crazy stuff. And it's, dense. So thermography excels in a few areas. Implants, because they cannot see tissue well when they're implants. I mean, they're going to pop implants. It's just not a good match. Inflammatory breast cancer, that's not detectable on a mammogram because it's an inflammation process. That's something very clearly seen on thermography. And so that, I think that's really important. But the density of breasts, it doesn't matter in thermography. Like the density of the breasts. So they say on a mammogram, if you have dense breasts, it's all white. And what they're looking for is white. So it's like trying to find a snowball in a snowstorm. And I'm like, then why are we doing it? Are you just going to push harder, apply more pressure, just irradiate more? Or I'm not opposed to ultrasounds. I have sent many women for breast ultrasounds to assess an area like a lump. So let's do thermography. And then I think a breast ultrasound is not a bad idea, because I think because that's what they do after they do their screening mammogram, their diagnostic mammogram. Then they send them for a breast ultrasound. I'm like, why didn't you do that in the first place? Because it's cheap. They don't make money on it. They don't make money on breast ultrasounds.
Yeah. And just
they're
another
safe
window.
and cheap.
Yeah. Why would we want that if we're the medical cartel? Yeah. Right. Well, you mentioned breast implants. I wanted to just highlight something there for a second. So thermography can help it, whether or not, obviously a mammogram would crush and explode whatever the implant is, but thermography could help in that sense. But I think there's a lot of women who don't know, back to your PAR-Q comment, they don't know the risks associated with implants, and the number of, go search for some online forums where you find women talking about the health impacts they have had having the implants over time, and then the health return they get when they finally have them taken out. So anything you want to say about that?
I do see and work with a number of women with breast implant illness. It's much more common than people would ever realize. And, do we see, I would never want to say we can see something like that on thermography. We can see inflammation. Breast implant illness is more, wow, my health went downhill after I got them, or I have silicone breast implants and now I have adhesions. And I'm like, you're leaking silicone, and silicone is poison. So of course you have breast implant illness now. So it's something That's a real factor right now with implants,
Mm-hmm.
for sure.
Yeah, yeah. Okay. Well, let's give the listener some insights into the process. So when I came and had it done just to be able to experience it, and I was surprised to find out I couldn't have caffeine, I couldn't have breakfast. There's a few things that you might not think of. So talk us through what a typical experience of having thermography done is like.
Sure. So the prep. We can't image any woman who is nursing until at least 3 months after. I kind of jokingly say your breasts are not your own. They are full of blood vessel development to create that milk, and they are very active.
Yeah.
So it's not accurate. It's not dangerous, not at all dangerous. There's nothing it's dangerous. Like there's no reason not to get it from a danger standpoint, but from an accuracy standpoint, post-surgery. So if a woman had a node removed, lumpectomy, anything, we need 3 months until that heals. My preference is often pre-surgery, 3 months after surgery, and then 3 months after that. So we can kind of map, because the physiology will change after there's a surgery. So kind of mapping the changes.
Okay.
So those are things, any type of surgery. So chiropractic, at least 24 hours, because that's, it's very physical. There is inflammation that's created. Massage, there's inflammation just from the physical. It's not bad inflammation, but it's inflammation that we might read like an overlying layer from somebody getting a massage. And so caffeine will definitely make people warmer in general. So that is avoided. We avoid deodorant, lotions, because we don't want anything on the skin. We want to see the skin in its purest state. So we always do a pre-exam questionnaire, or it's really informative, that we make people sign before they come in. So I make sure, yes, you've read it. Now, people could sign it and maybe not read it, but then I turn them away and say, you don't want to pay me today for doing thermography because you're not going to get the most accurate. Yeah. So prep really matters. Yeah. When they come in, they actually have to cool down and acclimate to the room. So I will usually I'll step out, have my clients remove their clothing, their jewelry, depending on what we're imaging, and sit in a gown for 15 minutes in a room that is 68 to 72 degrees Fahrenheit. That, they can't fold their arms. They can't be rubbing areas. People are famous for like, oh, it hurts here. And then they'll rub the area. That will actually create friction on the skin, which even the waistband, they'll have a rim or a red ring around where their waistband is. So I have them pull their pants kind of down far enough, depending on what we're imaging. If it's breasts only, they don't have to worry about that. But, I do a lot of screening that is full body. So literally every part of the body. I do female and male screens, which are pelvis up to the head. We include thyroid, the carotids, chest, breasts, abdomen, pelvis, all of that. And then breast only or region only. Sometimes I'll just do hands or knees. And the prep depends on what they're getting imaged.
Oh, okay. So tell us so you've taken the photos, you send them off to a professional, they look them over, and then you go through it with somebody. So what's that process, or the frequency of the tests that somebody might get with you?
Sure. So when we image our clients, we don't automatically go over the results. Now, not everybody wants to see that. Believe it or not, I feel we have more repeat clients who just want to read. The report is very detailed. The thermologists send back a beautiful report with their interpretation, all the images attached. And so I stand at the ready if somebody wants me to go over it, like, I'd like you to go over this. So I don't include that in the imaging price, because I don't want people to pay for something they don't even want. Yeah. So I do that kind of, a la carte. Okay. And so I'll go over it as a naturopathic physician and say, I think you should get this, do this, think about this, and that. And so the thermologists are quite quick, very thorough, very detailed. and I get that report. I always say within 7 business days. It often gets, is sooner, but I always like to say 7 business days.
Yeah. Okay. Anything specific someone might ask if they're searching for a thermographer or someone to do that for them? Is there anything they might not think to ask about when they're calling around?
Yeah, they're not all created equal, the equipment.
Okay.
I will only use Meditherm. It is like, if Cadillacs are still the top of the line, it's the Cadillac of the imaging, the
Okay.
thermography equipment. There's other companies that sell it. So Meditherm is medical grade only. There are many, 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 many cameras on the market that are industrial, and then they fine-tuned their range to make them pick up just the human body. Or, we also image horses. So I'll say mammal body.
Okay.
And so that is really important. Meditherm has superior thermologists in my eyes. The American College of Clinical Thermography is the group. They're highly trained. They're very, like I said, detailed, but they're in 48 countries. So you may go to someone non-Meditherm, and then you go to somebody else non-Meditherm. Maybe they have the exact same camera. They can't compare your first to your second. Something very important to say about thermography. Thermography is more valuable the more imaging you get. So when a woman comes in for breast thermography, we image. I always recommend they come back in 3 months. So 3 months, breast cancer cells will double in a 3-month period.
Really?
So if we see something suspicious, I often recommend an ultrasound if there's a lump, first off. But if we see something that's, suspicious, concerning, 3 months later, it would be magnified, like more, as I use the term, angiogenesis, more blood vessels. It's very webbing looking. Like you can literally see the blood vessels. They're like orange blood vessels sometimes that they're so obvious. So 3 months later, those two establish the baseline. If there's no change or positive change, then we go once a year after that. So your first thermography, I say get one, then get one 3 months later if we're looking at breast.
Okay.
And then once a year thereafter.
Fantastic. It's good, helpful just to be able to picture what that process is like. So, I know you got to get going soon, so we'll start wrapping up. But a couple other things I want to ask you. So I'm trying to put myself in the shoes of the listener, and obviously I'm not female, but if I'm trying to tell my doctor or family member or somebody that I'm going to decline the mammogram. So give the listener some confidence to kind of reason with or stand up to their doctor. What might they even say to deal with kind of the emotions or opinions of other people in their life who might question their decision to skip that? And what would you say to them?
Many people, unfortunately, are people pleasers. And I think these last 4 years, people are starting to stand up a little bit. And I think that there was a line drawn in the sand, really. And it's no, I'm going to stand up for myself, or no, I'm going to do what you want. People need to start standing up for themselves. Nobody else is going to stand up for you. Like, you've got to stand up for yourself. So if you have pressure from family members or from a doctor, fire the doctor. I mean, people are firing their families over the last 4 years. Fire the darn doctor. Like, there is no point. Go to somebody who will honor and respect your medical freedom. They are coming out more now, but I don't trust all of them. I'm not going to lie. I'm like, everybody's jumping on the bandwagon. I'm like, no, you weren't. I saw what you posted a long time ago when you were all for like making people do stuff. Right. So do your research. Do not do anything blindly. Make sure you get that PAR-Q. Do you know the risks? Do you know the benefits? Do you have questions to ask? If that doctor can't answer them, go somewhere else.
Thank you. Yes, I have used the phrase "fire your doctor" for a long time, and it's like people like, I can't disobey my doctor. Like,
I know. Like, yes, you can, and you should.
Yes, that person is supposed to work for you.
That's right.
You are the one giving them a job. And if they're not doing it well, then fire them. Like this is not hard. Find somebody else like Dr. Kelley who could help you with this. So,
yes,
okay. All right. So what I appreciate about you is just that you broadened the naturopathic principle of treat the whole person even more than the definition. You included mental, emotional, and spiritual. So talk to us about how that plays out in your work with clients.
So I do ask my clients about their spiritual health, and I have to admit, well, I see, so just so you know, I see clients from all over the country. So it's not just local. And my naturopathic side. So I kind of have two sides. I have my thermography side, which obviously I have to be in person.
Right.
And we do that in Raleigh, North Carolina still, and we do it in Florida. But it is, super, super important that people are finding kind of a like-minded community and searching out what makes them tick from a spiritual level. And I to each his own. I'm not going to be there to define what that needs to be. I am a believer in God, and I believe that, spirituality is a very crucial, probably the top of the tier in importance. And too many people are lacking it.
Yeah. No, as a coach, I love that because my work is I'm used to being in the trenches with people. And once you kind of clarify a plan of action and you set out to do the hard work of lifestyle change, right? Because at some point we have to address the lifestyle and habitual ruts that make you sick. But if we don't have a worldview that holds water, if we have a gross wound of inadequacy or lack of purpose or unworthiness, or if we have all of this is just cruel and we don't have hope to anchor to, that you cannot separate mental, emotional, physical, spiritual from each other.
You can't.
They're so intertwined to your physical health. And you can, to your point, you swallow all of the supplements every doctor will tell you to take and be no better off because
and I see that all the time because I'll see people after they've been to 6 functional doctors. And I'm like, well, how are we addressing these other levels? And I think we're addressing the physical level wrong. So, and they all have to be a player. But I have found that if the spiritual component isn't there, it's like it's an uphill battle. Really is.
Flounder or you did
flounder. Yeah.
Okay. So finally, let's just wrap up. So how to help the listener think holistically here? Because this is, you're so aligned with how I think and what we try to do for people, but where might a good coach or other practitioner be an asset or maybe a linchpin that they might not think of to really help them find success that would otherwise elude them? Or I guess what I'm saying is if you had to, one or two other types of health gurus, basically you're working at putting together your own A team to kind of fill out the approach to the whole person, right? Because none of us knows everything. Who or what do you think might make the biggest difference for people that they may not be considering?
So, I can't be there for my clients as much as, they may need. And I do my best and I'm very accessible, but a health coach, a like-minded health coach, like I said, I use like-minded because these last 4 years really have changed everything. So a like-minded health coach, if there's somebody who can literally make it easier for you to be successful and hold you accountable, it's everything. It's everything. I do my best, but having like a dedicated health coach is so important. And whether it be nutrition, whether it be, exercise, whether it just be lifestyle in general, like reducing stress, all of those, giving them actionable items on a day-to-day basis. So that's my number one.
Well,
number two,
that's great.
You're welcome. I believe heavily in health coaches. And so my husband is a trained health coach. He is also a medical massage therapist, but he specializes in craniosacral. So that's all part of, our interest and importance in our work together. But the next is an acupuncturist. I love Chinese medicine. I think it gets into people, that may not be the right term, but gets into their like deeper levels that maybe they can't access so easily
Hmm.
and kind of loosens things up, whether it's hormonal imbalance or blockages of, like even mental, emotional blockages,
Yeah.
stress management, whether it's Chinese herbs or acupuncture. I think a good, Master of Science in Oriental Medicine, MSOM,
Hmm.
is fantastic on the team. And I love a good, like-minded MD. They are hard to come by,
No kidding.
but they are hard to come by. But someone who will honor my training,
Hmm.
which is, surpasses most of theirs.
Mm.
But someone who truly wants teamwork. It's
Hmm.
not about stepping on toes. It's about filling in where we're needed
Yeah.
and knowing we're all working for the same goal.
Yep. No, I can hardly agree. That's why I'm tickled to death to be able to work with Dr. Gessling. It just finally, it's somebody I trust, who values aligned, who gets it, who sees the medical industrial complex for what it is and wants to help
Yes.
people. Yeah, it's so nice. That's a great, well-rounded A team. I like the acupuncture frame too, because often I still don't even understand it that much, but they're trained in reading the pulse. Like there's so many different levels at which they have developed such a
Like it's
yeah,
amazing what they can tell you.
yeah, the tongue, the pulse, there's like ways they can read things about what's going on in your body, similar to thermography. It's like there's actionable information waiting for you if you
Yes.
just know how to read it. So
Yes.
great answer. Okay, well, let people know where they can find you, follow your work, all that sort of stuff.
Absolutely. So easiest is my overall business is Liberty Natural Wellness. And that's the literal website, www.libertynaturalwellness.com. That talks about thermography. I do have a separate website for my thermography because I like it to be shown as it's a standalone. You do
Mhm.
not have to be my naturopathic client to do thermography and vice
Ah,
versa. I
okay.
keep them very separate. And
Okay.
I have a number of clients that do both, but I like to keep them very separate. But Northwest Florida Thermography, and it's nwfloridathermography.com. And I do free 15-minute Zoom calls for my naturopathic side. Or if somebody has questions about thermography, I'm happy to do it for them too. So I do free 15 minutes I give no medical advice in those. That's just to see, I call it medical speed dating. It's like, are we a good match for one another? Let's see, like, are you someone I am willing to accept? Because I'm kind of a stickler for who I accept. Like
Yeah.
you've got to be ready, motivated,
Right.
and
You,
really be, ready to move forward because we move kind of fast.
yeah.
But I want to give people that opportunity. They should also be interviewing me. Am I the right fit for them? Just like, are they the right fit for me? So people can schedule right on my website for those.
Fantastic. Well, and one other thing I'll highlight that you guys may have picked up by now is that she never used the word patient. She always referred to her customers as clients, which I love. So tell people why you do that.
So they need to be accountable. In a
Mm.
patient, it has been ingrained in people's heads that patient, doctor, you fix me.
Hmm.
And my goal is, no, you fix yourself. I'm just giving you the roadmap.
Yeah, love it. Okay. Well, Dr. Kelley, thank you so much for taking the time today. It's been a pleasure to spend time with you, and I'll look forward to talking to you again soon.
This has been a blast. I appreciate the opportunity, Christian.
All right. Talk to you later. Thanks for listening to Deconstructing Conventional. If this conversation sparked new questions or helped you see things in a new light, feel free to share it with a friend who is on a similar journey. Don't forget to subscribe so you never miss an episode and a perspective that challenges the norm. Check us out on our website at healingunited.today and find us on social media at Healing United, or you can check out the Healing United PMA app. It's a great way to stay connected. Remember, question everything and rebuild intentionally.